Basic Navigation in PowerChart Module 3. In this module, we will discuss key components that will assist you in navigation through your patient's chart. Let's start with changing your password. Cerner passwords are set to expire every 90 days. You will receive a prompt to change your password just prior to expiration. Should you need to change your password at any time, go to the top menu bar and click on Task. Then change password. You will be prompted to enter your old password followed by your new password twice. Then click OK. Should you ever encounter a problem with logging in or forgetting your password, please call our Shore Help Desk at 609-653-3403. Upon logging into PowerChart, patient lists and several toolbars are displayed. This is known as the Organizer view. The chart view will display once a patient's chart is open. In this next section, we will cover some of the icons located within the toolbar that will help you streamline your Cerner navigation. Let's start with the My Experience User Console icon. My Experience allows you to select your user position based on your assigned unit for that day. This is especially useful for those nurses who rotate to various nursing units within the hospital. Select the appropriate position, sign out of PowerChart, and log back in. The chart view will be appropriate for the unit you are working on. My Experience will be covered in detail with your preceptor. The Care Compass icon opens Care Compass. Care Compass is an innovative workflow page that guides users in the organization, prioritization, and planning of patient care. The use of Care Compass will be covered in detail with your preceptor. The Patient List icon takes you to the Organizer view where all the lists are displayed. If you have a patient's chart open and you click on the Patient List icon, you will return to the List view, but the open chart appears in a tab just above the Patient List title bar. Click on the tab to re-access the open chart. Our Cerner settings prevent you from having more than one chart open at the same time. The Exit icon closes the Cerner application. You will be logged off. This means of exiting the system is preferred over using the X in the upper right-hand corner of the screen. The Suspend icon allows you to put your Cerner session in a locked status for a brief period of time. This feature is useful in situations where you need to temporarily leave your workstation. Once you have suspended, the PowerChart screen minimizes and a blue lock icon appears in the taskbar at the bottom of your screen. To resume your session, click on the lock icon. Simply type in your password and click OK. The Calculator icon opens the Online Clinical Calculator screen. To use the calculator, select the appropriate formula from the drop-down field and enter the known value. The calculator will provide you with a computed value. The Ad Hoc icon stores all PowerForms for documentation. PowerForms are located in folders based on specialty. Documentation on PowerForms will be covered in another module. The Medication Administration icon allows you to access into the Medication Administration window. This is where you will scan the patient's bracelet, as well as the medications ordered for the patient. You will learn more about medication administration during our hands-on orientation session. The Patient Education icon is available on the toolbar for easy access to all CREAMS education. Adding education in real time provides the patient with appropriate education at discharge that is based on patient-specific problems and diagnoses. To add education, click on the Patient Education icon in the toolbar. Then type your topic in the search box and click All on the right-hand side. A list of educational materials will populate. Choose the appropriate material by double-clicking on the topic. After compiling your education, click Sign. All education added will print on discharge with the patient's discharge paperwork. To remove education from the patient education, simply click the red X under the selected instructions on the left-hand side of the screen. The patient pharmacy icon allows you to add the patient's pharmacy to the system so that a provider will be able to send the patient's prescriptions electronically to the pharmacy. To add a patient pharmacy, click on the patient pharmacy icon. If the patient does not have a specific pharmacy, click the box that says No Patient Preferred Pharmacy. If the patient has a preferred pharmacy, type in the pharmacy name, city, state, and zip code if available. Then click Search. A list of pharmacies will display on the right-hand side. Highlight the appropriate pharmacy, right-click, and select Add to Patient Preferred. The Patient Preferred tab allows you to maintain the preferred pharmacy list. If more than one pharmacy is listed, you can denote one as a default pharmacy. Notice the default pharmacy is displayed in bold font. To remove a pharmacy, right-click and select Remove. The BB Patient Inquiry icon is used to verify blood products from the blood bank. This function will be taught to you by your preceptor. The Lippincott icon will take you to our Lippincott Procedure Manual. This resource provides you with information on selected procedures. Click on the icon to access the Lippincott Index. Type the desired procedure in the search query box and click on the magnifying glass to search the database. A list of procedures will display. Click on the desired procedure to open a detailed explanation of that procedure. Click the X at the top of the screen to return to PowerChart. The last icon for discussion is the Depart icon. This allows access into the Depart process. Instructions on completing the Depart process will be covered in another module. So far, our PowerChart overview has gone through navigation from within the Organizer view. Once you open the patient's chart, the screen displays with what is known as the chart view. Our focus will now be on the chart view, or the components of an individual patient chart. Select your patient from the patient list, double-click on the patient name. The patient's chart opens. Notice all the toolbars previously discussed remain at the top of the page, still available for the user to use. If by chance you are missing one of the toolbars, click on the view, then Toolbar. Make sure Patient Toolbar, Navigation Toolbar links, and Action Toolbar are checked. Below the toolbar is the bright blue banner bar displaying key patient identifiers such as patient name, birth date, medical record number, and financial number. The banner bar also displays the patient's code status, isolation status, and allergies versus no known allergies. Please note the specific allergies are displayed under the allergy section of the menu, not in the banner bar. Below the banner bar and to the right is the refresh icon. This was mentioned in an earlier module. Clicking on the refresh icon updates your screens with any new data. It is important to refresh PowerChart frequently, especially after entering new orders. The menu is located on the left-hand side of your screen under the blue banner bar. The menu serves as a table of contents for the electronic record. The menu can be either minimized to the side of the screen or pinned in place. There are 8 sections within the menu that will be covered in detail in our training videos. iView, the task list, problems and diagnoses, allergies, histories, and form browser sections are covered in our documentation videos. Orders are covered in our CPOE video. The MAR will be covered in our medication administration video. Let's start with the chart summary section of the menu. The chart summary gives you a quick summary of your patient. This summary allows you to quickly identify key safety points for your patient as well as emergency contact, spokesperson, insurance, physician, procedures, and much more. No direct documentation takes place in the chart summary. The data displayed pulls in from registration, patient orders, and nursing documentation. Notice there are 3 separate fields for those associated with the patient: patient partner, spokesperson, and emergency contact. The patient partner is the person designated as an assistant in the patient's care. The spokesperson is the one designated to speak for the patient. You may find that the same person assumes all 3 roles for your patient, or in other instances, the patient has assigned a different person for each role. One other section in the chart summary relates to the patient's bed assignment for this encounter. The encounter location history gives you a dated, timed, unit-specific movement of your patient within the hospital. Here our patient came in through the emergency room. The nursing communication M page is next. This M page is set up in S-bar format. Notice the tabs across the top: Situation Background, Assessment, Recommendation, and Handoff. Joint Commission requires that handoff communication be set up in a consistent format, so here at Shore, the Nursing Communication M-Page Handoff tab is used when giving report or when receiving a patient. Let's take a closer look at the functionality of the M-Page. The M-Page is made up of sections displaying the most recent data related to labs, vital signs, and diagnostics. Each section can be expanded or collapsed using the arrow in the right upper hand corner. In the far right corner of the screen, you can adjust your view by changing the layout, rearranging the sections, and expanding and collapsing all sections. The M-Page can be brought back to its original settings by clicking Clear Preferences. Documents or diagnostic results from within a section can be reviewed by clicking on the blue font to open and display the document or report. Moving down the menu, let's take a look at the clinical notes section of the chart. Note types are found in file format on the left-hand side of your screen. Double-click on the folder to open. Notes are displayed by date and time. Hover over the note for more detail. To review a note, double-click to open the note. Notice the colored squares assigned to each note. These colors indicate the status of the note. Right-click in the Clinical Note area, then select Color Legend to view the legend. The gray search bar at the top of Clinical Note screen allows you to adjust the document count should you need to do so. Right-click, click on Change Search Criteria, verify the radio button is on the document count, and type in number of documents. You can request up to 999 documents be displayed. It is recommended you do not make any other adjustments in the document search criteria. Clinical notes can also be filtered by date, encounter, and who performed or created the clinical note. It should be noted that you as a nurse can create a clinical note. This is usually done to document an event such as a change in patient status and/or a phone call to a provider. To initiate a clinical note, click on the New Note icon. Select the note type from the drop-down. Next, give an explanation for the note in the subject field, like phone call to Dr. Smith. Once you've completed your documentation of the event, click Sign in the bottom right of your screen. Saving and closing a note is not advised because an unsigned note does not print in the medical record. You can always modify your note and/or add an addendum should you need to by right-clicking from within the note and selecting Modify. Let's now take a look at the Results Review section of the chart. Lab, microbiology, and diagnostic results can be viewed here under their respective tabs. In addition, any documentation completed on a PowerForm or in iView will be displayed in Results Review. The Results Review in Navigator functions like a table of contents for results and allows you to move quickly to desired results. The Flowsheet filter also assists you in locating specific results based on the view selected. The gray Clinical Range bar can be adjusted to a more specific date. Right-click directly on the bar to change the search criteria. Results are displayed in a specific color and may also include an indicator. Go to Options, then select Result Legend to access the legend. When reviewing diagnostic results, double-click directly on the cell to open the report. Click on the arrow door icon to close the window. Next, we will explore the AP Summary section. This provides you with anatomical pathology reports. The final section of the menu to be covered is the Patient Information section. Patient information is divided into 3 tabs: Patient Demographics, Visit List, and PPR Summary. The patient's address, phone number, date of birth, and ethnicity are included on the Demographics page. The Visit List tab displays every encounter the patient has had with Shore Medical Center. The PPR Summary tab displays all those Cerner users who have accessed the patient's chart. Users are asked to choose a relationship with the patient upon first accessing their record. The assigned relationship for each user can be viewed in the Visit Relationship screen in the PPR Summary. This concludes Module 3 and our Cerner PowerChart overview for nursing.